Good evening, friends. So, although we have done PCOS in past, when I was talking to Simi last time, after I saw her talk was liked, another area of lifestyle management is PCOD or PCOS. So, she said she has a proper diet management of PCOS, PCOD, which we family doctors generally struggle to advise patients. So I thought of skipping this topic, and I thought first 15 minutes I will just brush over the clinico-pathology and then hand over to Simi. The common menstruation disorders we family doctors face: premenstrual syndrome, no need to do hormone test, clinical diagnosis as well as management is very simple. You give folic acid, high dose for 3 months, and 95% of patients will be fine. Abnormal uterine bleeding, which requires a detailed history, which requires investigations, and then which requires management. At times, you may have to refer for surgery also. And then polycystic ovarian syndrome or polycystic ovarian disease. Today, mother of a patient asked me, "Doctor, is it PCOS or is it PCOD?" I said, it's one and the same. Some people call it disease, some call it syndrome. Why it is called syndrome? Because it has symptoms and signs of multiple systems of the body. A big name, but not scary at all. What is PCOS? In this, the ovary is symmetrically enlarged and riddled with small follicular cysts of about half to 1 centimeter in diameter. As many as 30 cysts can be seen at a time, but no report will tell you numbers. They will just tell you multiple cysts. It's a hormonal problem defined by the collection of its symptoms, because symptoms are not only OBGY, not only menstrual. Usually thought to be a lifetime female hormonal disorder or imbalance. What happens is a egg matures, and at the time person ovulates, and that matured egg becomes a follicle, and patient may conceive if she's in the reproductive age group and she's having proper relations, unsafe relations. That does not happen. The egg is not exposed, the follicles do not mature, and that gets converted to a cyst. The cyst then contribute to hormonal imbalance, and this imbalance causes more cysts. What causes the vicious cycle to start is not well understood, and it will vary from patient to patient. Insulin, diet, stress, fat, hormonal problems, all are implicated. Because type 2 diabetes is a common associated feature, or pre-diabetes. Diet management, stress management, exercises helps relieve the symptoms of PCOS. We don't know what it causes. Now, how do I explain to a patient? I explain to a patient or patient's mother over 2 minutes. Pay attention to this. I say that a woman's reproductive life is 10 to 50 years. That is 40 years. 12 months in 40 years is 480 months. A normal female will produce 480 eggs over her lifetime. 240 from one ovary, 240 from another ovary. What happens, we don't know. Somewhere in between, these premature follicles, they stop growing. Because most PCOS, if you ask, no, they've had a normal menarche, they've had normal frequency of periods in the beginning, and then they become irregular. So I say that certain follicles fail to mature, and as nature has made it perfect, it is pre-decided which month, right ovary or left ovary, which follicle will mature. The month the designated follicle does not mature becomes anovulatory and no periods. This is PCOS, and this is what we have to manage. Stell and Leventhal in 1935 defined this as association of amenorrhea with polycystic ovaries and variably hirsutism and or obesity. Today, we identify PCOS with hirsutism and obesity and prediabetes. American College of Obstetrician and Gynecologist and National Institute of Health in 1990 said it's a condition of hyperandrogenism and chronic anovulation, excluding other causes. We know that only after ovulation occurs, in 15 days, the period will occur. No ovulation, no period. 33% of women who are obese, 8% of women who have type 2 diabetes, and 27% of infertility cases which are not producing a follicle have PCOS. So you can now understand and you can accept that it has various presentations. 5 to 10% of women of reproductive age have PCOS, which is as high as diabetes. Epidemiology, prevalence 4 to 6% females worldwide, 75% of women with irregularity of menstruation or infertility. What's the association between insulin resistance and PCOS? The treatment of insulin resistance is diet management and exercise. The treatment of PCOS is diet management and exercise. That is why today this talk. So there is a signal genetic defect. When you take a history, father is mostly a diabetic and has male pattern baldness, and mother or sister has PCOS. It's autosomal dominant gene. It causes insulin resistance, and the autosomal dominant gene causes PCOS. Insulin resistance and PCOD, PCOS are interconnected and dependent on each other. You reduce insulin resistance and PCOS will get corrected. Faulty lifestyle in a patient with insulin resistance gives you type 2 diabetes mellitus, and PCOS also gives you diabetes mellitus. Low gonadotropin releasing hormone leads to low luteinizing hormone, and that gives PCOD again. This gives increased androgen, hyperandrogenism, that gives low estrogen, and low estrogen gives low gonadotropin releasing hormone, and then it leads to PCOS. You can take a picture if you want for ability to see it later also. Is PCOS equal to infertility? No. Because if treated well with lifestyle management, most PCOS will conceive. PCOD or PCOS does not equal infertility. Some women with PCOD have no fertility problem at all. They just conceive spontaneously. The stress of having such a long name condition may contribute more to infertility than PCOD itself. A positive history in either mother or sister or maternal grandmother proves that fertility is possible because they conceived, no? So our patient can conceive. Infertility is just another possible symptom of PCOD. It is not equal to infertility. More than 80% of the women with fertility problem caused by PCOS, properly treated and with patience, will conceive. If the other factors are normal, the semen count is normal, then all you need is to give ovulation to this female. What are the clinical features? Symptoms: menstrual irregularity. You ask the patient, your period, what is the frequency of period? The patient will say, doctor, uska man mein hai tabhi aata hai. It comes when it feels like irregularly irregular. I have no frequency. Hirsutism, acne. Infertility, female factor. We are not talking of male factor. Infertility because of anovulation. Obesity. Signs are hirsutism, acne, obesity, acanthosis nigricans, which is an indication, dark pigmentation behind the neck in the folds, which indicates insulin resistance and prediabetes, male fat distribution, wider shoulder than hips. And this one factor, my dear friends, is so specific. I have a patient walking in my clinic with her mother. She may be around 18, 19 years old. I look at her. She has wide shoulders than her hips. You know, females generally have wider hips. And I ask her a question, are your periods irregular? And the mother will ask me, how do you know? They've come to me first time. You can walk into a girls' college and pick up PCOS by just looking at this one factor. And second factor is breast development is out of proportion to physique of the person. These two you can pick up before even you do investigations. Investigations, LH-FSH ratio above 4 is diagnostic of PCOS. An ultrasound will show ovarian enlargement with multiple cysts. LH-FSH more than 2, likelihood of PCOS. More than 4 has PCOS. This is how the ovary will look. How do you manage? We should not panic. We should assure the patient not to panic. Approach in girls, unmarried girls, or women not wanting a pregnancy is one approach. Women desiring a pregnancy is another approach. Since the main problem here is anovulation, we know that a period occurs when progesterone levels drop. It is a withdrawal of progesterone that gives the menstrual bleeding. So if a patient is not ovulating, there is no progesterone in her system. She is under only effect of estrogen. And that can be more harmful than the PCOS itself. These patients are given progesterone pills after not getting a period after 45 days from the due date, till they get married and they desire children. Approach to women desiring children, they're given medicines to cause ovulation. Almost 70% patients ovulate with one course only. If husband semen is normal and other causes like blocked tubes is ruled out, and other couple is having a normal frequent sexual intercourse, pregnancy is the likely outcome. If 3 cycles are not successful, we wait for 3-month period before embarking on next cycle of treatment. Long time back, maybe almost 35 years back, I had presented a study of 42 cases of PCOS I had managed in my clinic without referring at a GP Association annual conference. After the family is complete, they are treated like unmarried girls only. Only here now, because they can ovulate anytime, contraception becomes a bigger stress. A normal period patient can take precaution only in the unsafe period. These people have to take precaution all the time. Surgery, sometime ovarian drilling is advised. It's not a permanent solution. Usually only straightens out the hormonal imbalance temporarily, maybe for a year. The risk of surgery is that it could cause adhesions, which will reduce fertility until removed by another surgery, and small risk of complete ovarian failure due to ovarian trauma. So, unless really wanted, to be avoided. Unmarried, not desirous kids, progesterone for withdrawal, bleed after 45 days of no period, 30 days of normal waiting period, and 15 days extra. Medroxyprogesterone acetate 10 milligram, the brand name is Dietary, 1 BDU for 5 days. Do not expect periods immediately after that, because this is going to give a surge in progesterone level when that gets withdrawn. So 5 to 8 days after the last pill is the time that you expect periods. And treat other symptoms by lifestyle management, which Simi will talk to you today. Married desires kids, clomiphene citrate 50 milligram per day for 5 days from day 1 of the cycle, or 1 day, 1 OD from day 3 to day 5 increases FSH. USG on day 11 to 12 to confirm ovulation. When you're treating infertility, you have to do ovulation profile. Pertomid 50 or 100 or Clomid 50 or 100 is the brand name. Clofert 50 or 100. This is all from my side. Now I hand over to Simi. And Simi, please take over. This, because this is a talk by an external speaker, will be available on YouTube permanently. Simi, over to you.
Thank you so much, Uncle. And today it's my dream come true, sharing the platform with a mentor whom I've been looking up since
Thank
the
you.
childhood. So it's a great moment for me. Good evening, everybody. I'll just share the screen. Just give me a
Just
second.
1 second, Simi. There are a few questions.
Yeah.
Clofert, I have given mostly used day 1 to day 5. Yes, there are thin PCOS also. And PCOS patients who are thin and who do not have the male distribution of fat generally conceive without any hassle. Thank you very much. Bye.
Good evening, everybody. Is my screen visible to all? If anybody could just put me a thumbs up in the chat box.
Yes, yes, it's visible.
Yeah, okay, fine. Good evening, everybody. As Dr. Asrani discussed about the PCOS, I'm going to talk about the managing part of it. Now, you must be wondering, why is this? I'm not going to give my description as to what I am and who I am. I just want to know that I always work on the 4 principles in which I work on lean, exercise, attitude, and nutrition. Today, how to manage your PCOS. So I have tried to make it as simple as possible, and I tried to put it in a very easy manner. you have to be a detective. Now you must be wondering is why is she saying that you have to be a detective when you have to manage your PCOS? Because what works for one may not work for another one. So how do you know that what are the points or what are the things that you should know when you're having this problem? So always keep a journal. What are your PCOS triggers? What kind of foods make your body feel the best? Do certain foods make your symptoms worse? Does going too long without eating, it gives you a craving of eating something sweet and again eating something salty? Or is there any supplement that works for me? So it's like you have to know what is your issue, and you cannot identify unless and until you write this down. Now, many a times people, they start judging themselves, judging in the sense, in the way that maybe I have no discipline, that's why I got PCOS. If I have PCOS, no one will ever love me the way I am. I'm so bad that this weekend I cheated with my diet. I can't sustain a diet plan. I have no willpower and I'm not thin enough. So these are all the doubts that come in people who suffer from PCOS. So my first and the foremost thing is do not be a judge. Do not judge yourself. Okay.
Simi, sorry to interrupt. Just put it in full screen, na, please.
Just give me a second. Full screen. Wait, I'll just stop sharing it and then I'll share it again. Just give me a second. One minute. It's not giving me an option of full screen actually.
So it's on the your right left hand side corner up above the home above on the red bar next to it the slide.
1 minute. It's not giving me that option. Just give me a second. Sorry for this. Uh, 1 minute. I'll just put it in the it's not giving me an option below to just give me a second. Just give me a second, please.
Yes, yes, sure.
Now, is it visible?
First share the screen.
Yeah, just give me a second. Now, is it visible?
Screen, yeah, it's on full screen now.
Yeah.
Yes.
Okay. So, sorry for the problem. Okay. So, in the new research, you must have heard today everybody talking that go gluten free or go dairy free. Why? Because the new research is showing. Do you think it's right? No, April Fool. It doesn't work that way. So, you don't have to be on a gluten free or on a dairy free diet because, as I said, all are different. Why? Because in some case, there must be a different degree of insulin resistance. Some people, it could be must be having a lot of food sensitivities. The degree of inflammation could be different levels of androgens. Cultural food preferences would be different. Cortisol levels could be high. Lifestyle issues, as we're going to work on it. Food preferences, food intolerances, gut microbes, genetics. There are so many things. So I always tell people, please do not refer to your social media for curing your problem or following somebody else's diet plan, because it doesn't work. Even today, what I'm going to share, please don't start following it without taking into consideration how it needs to be taken and how much to be taken. So there is no one PCOS diet which is a standardized diet plan which you get. Of course, on Google you may find one standardized diet plan, but if you go to a qualified dietitian, definitely that's not going to be the case. Now, how do you know? How do you manage your PCOS? So I've just made a small pyramid here for you to make it more easy to understand. So the first and the most important is the mindset. As I told in the beginning, please do not judge yourself. I'll be talking about it in my last slide. Why? Because I'm talking about the most important uh, thing in the pyramid is nutrition. We're going to talk about gut health. I'm going to talk about the anti-inflammatory diets and the diet to decrease the insulin resistance. Of course, daily exercise also plays a very important role. You need to have some daily movement. You can't be a sedentary person. Yoga, cardio, resistance training, that also differs from person to person. Supplements at times are needed. Meal times have to be disciplined. Stress, of course, has to be controlled, and avoid endocrine disruptors. So what do you mean by this endocrine disruptors? Like taking a hot thing in a plastic bottle, or trying to take something that's frozen. So these are all the that will disrupt the hormones inside your body. Now, it's a hormonal roller coaster ride for the people who are suffering from the PCOS. But in case if you're having a high cortisol, your symptom could be anxiety, a midsection weight gain, irritability, weakness, weird, tired, inability to even relax yourself. In case if you are having high insulin, you must be feeling drowsy all the time, especially people after eating. They say after eating a heavy meal, we feel drowsy, but actually, it is the problem is with the insulin which is inside your body. Cravings of eating something sweet after your meals is again not appropriate, or it's not healthy. Having a marks on your neck in the terms of black is an acanthosis and inflammation. And if you're having a high testosterone, you must be having hair thinning, facial and body hair. And today, every female, they want to look good and beautiful. So let's solve all these problems today. Now, going to talk about gut microbe. As we all have heard, that mind and gut are interrelated. That's the recent and the most in topic in today's world and today's scenario. Why? Because our mind and gut are interrelated, and they have found out about it. So whenever you are stressed, there are a lot of microbes which are there inside our body. So what happens is it gets disturbed, and at times it increases your IBS symptoms. In case of low gut microbe, it causes insulin resistance, elevated blood sugar, obesity, high androgen levels. Many a times people, they have a lot of inflammation. So how do we increase, or how do we make our stomach really healthy? You must have heard that going through a man's heart is through his stomach. So whatever sayings previously the older generation used to say, there was some scientific reason behind it. It's only that in today's world we have forgotten all about that. We do go through the stomach, but in an unhealthy way. Okay, so how do you improve your gut health? So it's very simple. As I said, you need to manage your stress. You have to fill up on high fiber, which I'll be talking about. Avoid very fat diets. Now, there are a lot of fat diets which are there. Some people, they say do not eat till the breakfast. Many a times it is said that do intermittent fasting with this window, 16 hours window, 12 hours window. I don't think it's needed unless and until you can understand your body. Many a times you eat antibiotics. So in antibiotics, the friendly germs are also killed. Limit your alcohol. You have to eat foods that are rich in pre and probiotics. Need to get an adequate sleep. You need to limit all your animal proteins. You have to eat foods which are rich in polyphenols, and you need to consume a variety of plant-based foods. Now, insulin resistance and PCOS. Now, how this is interrelated. So, whatever food you eat, it makes insulin, but it does not enter your cells. Why? Because it is getting resisted. So what it does, it makes it into fat. When it makes it into fat, you always feel tired and hungry. You feel as if you have not eaten anything, and even after a heavy meal, maybe after an hour, you again feel hungry. Now, many a times in today's world, I get come across patients or I come across clients who skip their breakfast. Why? Because they don't have time for cooking. So when they come to me after taking the family history, after taking their history of how they work and what they do, I plan a breakfast in a way which is very easy that can be followed even if you are working. Okay. And many a times when we skip the breakfast, you're very hungry by the lunch hours, you get a lot of cravings in the afternoon, and then again in the dinner you're very hungry. So it's like a vicious cycle, and you keep on, you are unable to break any one of the cycles. So never ever skip your breakfast. It's not at all advisable. I also say that never have only fruits or juices for your breakfast, because your stomach really needs to have a good breakfast, which you have to be taken properly. Now, what happens is many a times it is considered that carbs are the evil. If you say, "Oh, carbs, oh God, we are off carbs, we are off this." So I think it's not needed. Carbs, at time, good carbs are needed by the body. We have to focus more on the low glycemic index foods. Why? Because when you take the low glycemic index food, or when you take the healthy carbs, it basically decreases your inflammation, it improves your hormonal balance. Of course, if the hormonal balance is good, your mood is good, it decreases the heart disease, it decreases the risk of eating disorders, it improves your sleep, it improves your insulin resistance, of course, the gut health, and then in return, it improves your energy levels. Now, many a times it is said that how do we include fiber in our diet? So I would just give a very easy way is we all can include fiber in our all three meals in a very easy manner. You don't have to buy anything fancy. Maybe in the morning before you start your breakfast, have one carrot, which is good in this season. In the lunch, you can have maybe one cucumber or two cucumbers, and in the dinner again, maybe you can have two tomatoes. So it's very easy to include fiber in your diet. It's only that we are lazy, and at times we do not work on that. So eating a fiber or beginning the meal with a fiber, it will help in maintaining your insulin levels. And definitely fiber decreases your cholesterol levels. You won't suffer from constipation. That is why, it's a myth that when you take isabgol, it's basically for cleaning your stomach. Actually, isabgol is nothing but a natural fiber. It's called as the xylem husk. When we take a lot of fiber, it decreases our inflammation. It helps our body to detoxify. Of course, it helps in weight loss, because your body or your stomach gets full with the fiber that you have. And all these, again, we come to the same parameter: is it improves your glucose, it improves your heart disease. I mean, it basically helps you in everything in life, with all the non-communicable diseases that one is suffering from. I always tell people to include a lot of seasonal, local variety onto your plates. Now, when you're dealing with PCOS, I emphasize more on red, white, and blue foods. Now, what are these red, white, and blue, and what does it do? So when we talk about the red foods, it's your tomatoes. It has lycopene. You have strawberries in this season. Watermelon, of course, in summers. In rainy season, of course, we get cherries. So if you see, God has also designed all the fruits and vegetables according to the season, and each and every vegetable has its own benefits. You don't have to buy anything which is not in season. So definitely in winters, you don't have to go in for watermelon. You get very good strawberries everywhere in whichever part of India you are in. What does the red fruits or vegetables, what does it contain? It contains a lot of vitamin A and C. and phytochemicals which will help to fight for your body. As I said, the tomatoes have lycopene and anthocyanins, which helps to decrease the inflammation, and some also decrease the insulin resistance. That is why I already gave you an example. When you start a meal, you can take those fibers before you begin your meal. Now, when I talk about the white foods, what does the white foods do? The white foods is like your mushrooms, it's like your cauliflower, it's your banana, it's your onions, it's your garlic. Now, many a times there's a lot of misconception that if we are pre-diabetic and diabetic, we can't take banana. But definitely, if you are consulting a qualified dietitian, everything will be included in your plan depending upon your blood parameters and depending upon what you like to eat. Okay, so what happens when you take a lot of white foods in? It basically contains the chemical called as lysine, which helps in lowering your cholesterol, your blood pressure. It reduces the risk of stomach cancer and heart disease. And we all know that onion and garlic, they contain prebiotics. Okay. Now, many a times in certain communities, onion and garlic is not taken. Then in that case, nowadays you do get garlic supplements, so which can be included in that. So when we talk about the blue fruits and vegetables, you can see there is brinjal, there are figs, there are grapes, there's a red cabbage. So all these foods, they basically help you to reduce your cholesterol, and at the same time, uh, it helps you in preventing the stroke and the cancer. And blueberries, which you get it in the season, are excellent for insulin resistance. Now, I use a lot of flax seeds with my clients or with the people suffering from PCOS. Why? Because flax seeds, they contain lignans. Now, what are these lignans? They have the soluble and the non-soluble fiber. Again, it's the fiber that helps to decrease the insulin resistance. It will help you to decrease the hair, what you get around your chin, or the more facial hair that you have. It lowers your triglyceride levels, more regular. It makes your menstrual cycles regular. It decreases your inflammatory markers. Now, how do you use it? So if I stay in Gujarat, so actually many a times they take it in the mukwas version. But then I would suggest that if you want to take it, 1 tablespoon can be taken in your buttermilk or in your curd, because curd is a good probiotic. Now, when I talk about curd, it has to be your homemade curd and not the curd which you buy it from outside, because when you buy an Amul or any other brand of curd outside or a yogurt outside, it does not have the live bacteria or the live cultures in them. So very easy to include the flax seeds either in the curd form or in the buttermilk form. If you don't want to take it in that, you can even take it in the lime juice. So it's very good. Like, you just need to keep stirring it and you can take it in that. The second thing what I normally use is the cinnamon in terms of PCOS. Now, why cinnamon? Because cinnamon has a natural chemical. It's called as cinnamon amaldehyde, which increases the hormone progesterone and it decreases the hormone of testosterone. So it basically helps for hormonal balance. It also helps in lowering your cholesterol levels. Now, as I said, each person is different. So whatever suggestions I am giving here, maybe even if it's a 1 tablespoon or maybe if it's a pinch of anything, please do not follow it. Please ask your family doctor, or you can consult any qualified dietitian for going ahead in treating your PCOS. So this basically cinnamon, I normally give it in lime juice. It can be made in a very good form of herbal tea. How much quantity and depends upon the from person to person. Now, what does the cinnamon do? Again, it lowers the cholesterol levels. It reduces the risk of heart disease. It decreases the AMH level. It decreases the inflammation. It helps to regulate your menstrual cycles, and it lowers your blood sugar levels. Now, I have here given a lot of options for the green tea. Why? Because I'm not talking about the tea which you get it in the market, but many a times you do get certain things can be made at home, like the tulsi tea can be made at home. The ginger tea can be made at home. The cinnamon tea can be made at home. Of course, the chamomile tea, you will have to buy it from outside. Why? Because it creates a calming effect. It helps you to sleep better. Why? Because in PCOS, we need to sleep properly. Then only our hormones get regularized. So many a times people, because you're sleeping quite late and because of your schedules, it's not easy to shift the body clock from 12:30 to 10:30. Like today you're sleeping at 12:30, I cannot expect you to sleep at 10:30. So there is where the chamomile tea takes place. If you take the chamomile tea somewhere around 5:36, then the melatonin by 9:30, when it starts, according to the circadian rhythm, when it starts producing, that's the time it will help you to get a good sleep, and it will make you calmer. Now, many a times, as I said in the beginning, the research shows you need to go dairy free and you need to go gluten free. But according to me, I don't recommend that. I always say that have yogurt, which is homemade. Going for kefir. Of course, kefir is something that you get it in the metropolitan cities. It's not available in the small towns. Kimchi is nothing but a cabbage which is taken and grated and added a little bit of salt and pepper and very little of lime, marinated till it turns into a juice, and keep it outside. Depending upon the temperature, you will have to identify the moment it gets sour, keep it inside the fridge and take it very little in your meals to increase the probiotics in your gut. Now, there are a lot of herbs we all know about, or a lot of spices that we know of, which are very good in terms of regulating the hormones. So, if you see, I have put a picture of fenugreek. So, we all discussed about, we all know that methi seeds. They also have a, a chemical in it which helps to regulate your insulin levels, and it helps to maintain your insulin levels. Ginger, of course, it's anti-inflammatory. Cinnamon, we already spoke about. Cayenne peppers, you can make a good chutney out of it with tomatoes. So it's a good combination that you can do. We can even use oregano at times. Clove can be used, and saffron can be used in the milk at times to uh, make the PCOS come in the regularity. Now, I recently attended a conference in Mumbai, and where we had very eminent speakers there, and there we learnt about vitamin D. Now, vitamin D is interrelated with the PCOS. So please get your vitamin D levels checked, because if your vitamin D is low, then there could be blood pressure issues, there could be fertility issues, there could be inflammation, there could be irregularity of your menstrual cycles, uh, even anxiety and depression. So please regularly get your vitamin D tested and consult your physicians for giving you the right dosage. One of the most free stuff that I always tell people, that this is something which you get it for free. You don't have to spend even a single penny, is to drink water. Now, people have forgotten to drink water is because they all sit in AC rooms or AC offices, or they are sitting sedentary and they don't feel thirsty, and so they don't drink water. And that's the reason most of the time they are tired. Now, how do you know that you are drinking the right amount of water? So, normally in winters, it's 250 ml into 8 should be 8 glasses should be your minimum water intake. So whenever you go to the loo, just check your urine color. So your urine color has to be light yellow, or maybe not even white, because if it's white, you're drinking more amount of water. And if it's on the darker side, that means you are dehydrated, and you need to drink proper amounts of water. Why? Because we all know that there are so many trimillion cells in our body. For all the functions in our body, we do need water. 70% to 80% of our body is made up of water, and this is, as I said, it's for free. People have forgotten about it. They need a app to remind them that they need to drink water. You can imagine this is the state of today's generation, wherein they have to put an alarm, or maybe they put an app to remind them to drink water. It's not bad, but please to remind yourself to have proper amount of water, which is really, really very, very important. Now, this is something which I recommend to some of my clients, is the MCTs, that is the coconut virgin cold pressed virgin oil. It depends on what quantity to be taken and how to be taken. It depends on the person who comes to me. Now, what does this coconut oil do? So it improves your energy levels. It is made up of medium chain triglycerides, and they're quickly turned into ketones, and they're used for energy by the brain. So it naturally, when you have good energy levels, your insulin levels are also at normal, at par, and you tend to live better. But as I said, just don't blindly start taking it. Yoga is something which is my recommendation for people suffering from PCOS, because I have seen a very, very good result when people start doing yoga. But always remember, YouTube is there for your information, but always go to a qualified instructor to take a proper lesson or proper degree if they have taken for yoga, because everything is related with the breath you take. So these are some of the asanas which I recommend, and I feel it's very important for regulating the good hormones in your body. Now, sleep. Dr. Asrani has just posted a reel yesterday about the sleep hygiene. Now, what does that sleep hygiene mean? As I said, that we all need to take a pledge to sleep on time. The reason behind is we have circadian rhythm, and according to the circadian rhythm, 9:30, melatonin starts getting produced, and that's the time when you start eating food. So what happens? The mind is saying, "Arey, melatonin is getting produced. We have to sleep," but they are putting insulin in our body. They are putting glucose in our body. Now, what to do? So they get confused. So you are confusing your body, and the mistake is you. That is why it's called as a lifestyle disorder. So what do? I don't say from 12:30 you can shift to 10:30, but every week you can shift your clock by half an hour behind, like say from 12:30 to 12, then from 12 to 11:30, and it's going to be a slower process, because it's an easier way to push the body clock further, but it's very difficult to push the body clock at the back. So what can you do? So we all know that we need to be away from social media. You can imagine Netflix searches for us to be awake. Why? Because Netflix wants all of us to be unhealthy. That's what I think about. Uh, that's why we all have to follow the saying, early to bed, early to rise makes a man healthy, wealthy, and wise. So in my house, I'm the only one who sleeps by 10 o'clock, no matter what and where I am. And exercise mat is always lying next to my bed. Why? Because as soon as I get up in the morning, it reminds me that I have to exercise. And why do I do all these things? Why? Because I want to live long. I want to educate people to live healthy and absolutely disease free. Now, these are some of the affirmations that I tell my clients to say, because affirmations really work. I have seen it creates wonders. So it's like a combination of diet plus sleep plus exercise. And when I say attitude, this is what I was referring to as. So you all can take a screenshot of this, and as it's going to be on YouTube, you can refer to it. So anybody who is suffering from PCOS and you want to do it, you can do this. And nowadays a lot of methods are there. So as soon as you get up in the morning, you can just it's very easy. You can by heart songs. So in the same way, you can by heart this 4 to 5 lines, and you can just get up in the morning and you can say these lines. And trust me, you will see that there is a lot of difference, which you will see in a month's time. A lot of improvement. I've been dealing with a lot of PCOS clients, and there's a lot of improvement in them, and it's like they wonder like how is it possible. But trust me, when you make all these changes, it really works. Thank you so much everyone for patiently listening to me, and if there are any doubts or queries, it can be asked in the chat box. And that's my website and my 2 mobile numbers if anybody wants to contact me. Thank you. Preeti, I'm done with the session. Any questions? If anybody wants to ask, you all can ask because it's very, very important. Just give me a second. There's a question which I can see people asking about the vegetarian options. I think vegetarian people, they have more, of course, PCOS is a curable thing, as Dr. Asrani said. It's very, very important. Why? Because as I said, it's a lifestyle disorder. So today, everybody has forgotten the old roots. We all are so difficult to put things in today's world. We are always in a rush. We are always stressed to be a perfect mom, a perfect wife, a perfect daughter-in-law. But trust me, a little pre-preparations and you can do it. You can imagine that I don't have a cook in my house and I'm a working person, but then I pre-plan my stuff. And trust me, when you pre-plan your things, it really becomes very, very easy to do. Now, how can you remain away from stress? Somebody has asked me this question. It's very easy. If wherever you're sitting in the office, I just want you to sit in a very straight position, and I want you to take a deep breath in, hold there for 5 counts, and exhale it from your mouth. Trust me, you do 3 counts and you will see that your body goes calmer. Drink a glass of water and just do this breathing 3 times, and you can message me and tell me how do you feel when next time you are stressed. You must have seen many a times we sit on a table and we start pressing, and like we start pressing our neck. So why do our body hands automatically goes to these places? There is a vein which is interconnected to our brain. So that is why we keep doing this, or we keep doing this. It's our body's mechanism to cope up and to make the hormones or the stress levels go down. The flax seeds have to be raw. It has not to be roasted. And if you're taking it in your curd or in your buttermilk, it has to be in the raw form. Please do not roast it or grind it and keep it, because it releases an oil. It will make the seeds rancid. Now, how do you decrease estrogen naturally in a patient of PCOS? See, that's what I said. It's the diet that matters. The moment we start using the combination of vegetables and the meals that we take in, automatically our hormonal levels get better. Today, if you see, whether it is diabetes, whether it's constipation, whether it's acidity, whether it's high cholesterol, everywhere it's the diet what we eat. Today in India, maximum breakfast is poha, upma, paratha, bhakri, and none of them have proteins, or none of them have uh, the fiber that is included. That's the reason why I said that you don't have time to cut and you got good teeth. Come on, let's just chew a carrot in the morning and then take your poha. Okay, add a bowl of sprouts. If you don't have sprouts, you've forgotten to put sprouts, you can take the raw soaked peanuts in this. So there are so many ways. So for that you need to consult a qualified dietitian. The Google Baba or the WhatsApp University is not going to help you. Now, does animal milk affect hormonal health? Yes, at times. Uh, as I said, I only talk about probiotics. So when I'm talking about probiotics, I'm talking about the milk products. I'm not talking about the milk, because today whatever milk comes in the metropolitan cities, it is coming to your house. There is some way or the other, it does have the steroids in it. So I always tell, instead of drinking 1 glass of milk, convert that 1 glass of milk either to paneer or to convert it into your curd, and take that, because that increases. So whenever you make paneer, don't throw away your water. Keep the water, knead it in the dough. You can use it in your gravies. So you have to be a little intelligent enough in today's world how to manage and do things. Uh, for fruits that needs to be avoided, there is nothing. As I said, no one diet fits all. So depending upon your genes, depending upon your family history, depending upon your blood parameters, the fruits, the vegetables, the protein, the carbs, they are calculated in that. I'm not saying that poha, upma, and bhakri is not good to have. It is good to have, but it is a carb based. So if you're having these issues, it's not going to help you, because the moment you have these, within an hour, you feel hungry again. So when you add vegetables, when you add fiber, when you add protein, the glucose is released slowly. The graph doesn't increase up and down. The graph goes very, very slow. Animal proteins can be had. You can have egg whites, really nice. You can have chicken soup, you can have a chicken salad. So as I said, no one rule fits all. So the questions what everybody has asked, I think I have answered to most of the questions in the chat box. Anything anybody else that needs to have? I must have missed the starting questions. I will just have a look at it. Just give me a second. Show the yoga asanas you suggested. I would say that you can contact any of the yoga center which is in and around you, because as I said, I always believe that you need to consult a professional when you do this. Is there any role of metformin? Of course, yes. Metformin is used at times for maintaining your insulin level. So depending upon what your general practitioner or your gynecologist or an endocrinologist, what they ask you to do for metformin. As I said in the beginning, supplements are needed at times. No one rule fits all. So I think I've answered to that. And any other questions? No, I don't see any other questions in the chat box. And I think I'm done with that. Just give me a second. 3 new messages. Thank you. Okay. Mayo inositol good for PCOD? Of course, yes. It has been, they have been using nowadays for certain PCOS clients, especially the younger generation, and it's really very effective, and it's playing a really good role in helping the people to get the regular menstrual cycles. If you take more vitamin. How to increase the insulin? I didn't get the you mean to say how do we stabilize the insulin? So when you stabilize the insulin is, as I said, start your meal always with a fiber, then take a protein, and then take a carb and a vegetable, and you will see that your insulin levels are well maintained. And you can refer to this channel. There is already a talk on pre-diabetes and diabetes which I had taken on the diet, so you can check that particular site for your answers for this. Thank you so much, and over to you, Preeti. I'm done with the questions.
Okay. Thank you, Simi. Thank you so much for this session, being a part of this session. And if there are any more questions, I'll just send them to you, and we can connect with the people.
Yeah, sure. Okay.
Yeah.
Thank
Yeah.
you.
Thank you. Thank you so much. Thank you, everyone.